Welcome to the Payer to Patient to Paid webinar hosted by the American Association for Home Care and Medtrade. We appreciate our presenters, Jennifer Leon and Ashley Brown of Brightree.
Hello, everyone. Thank you for joining our webinar. My name is Jennifer Leon, and I'm with my fellow colleague, Ashley Brown. We are both work at Brightree, and we are excited today to provide this webinar to anyone that was unable to attend. This presentation was first presented at Medtrade in 2024. So we're excited to work with both AAHomecare and Medtrade to bring this webinar to you today remotely. I'm going to ask Ashley to go ahead and thanks, Ashley. And just wanted to mention to everyone, Brightree is extremely honored and excited to be a part of both organizations and supporting both organizations on the screen here, AAHomecare as well as Medtrade. And we hope to see everyone in Medtrade, at Medtrade in 2025 back in Dallas. And with that, we're going to go ahead and jump into our learning objectives today. We are going to explore some tactics, some key tactics in creating a foolproof intake process. As you know and may understand, if your intake process is clunky or you don't have a complete and thorough intake process, that's when your train can kind of get derailed. So we want to make sure that you're fully aware of what the foolproof intake process can be. We're going to also touch on some technology that's going to help you streamline that workflow process. And then we're going to also share some stories from some of your peers that have taken the initiative to change their billing practice and just give you the results, if you will, and return on their investment that they have found through providing, a thorough intake process, streamlining those workflow processes, and just adopting some technology to help them through it all. With that, I'm going to pass it over to Ashley.
Thanks, Jen. Let's dive into discussing the foolproof intake process, how to work smarter, not harder. We're first going to discuss some fundamentals that will help set the foundation of your foolproof intake process. It's important to document your business process for your team members and your organization. For example, do you or don't you collect upfront payment or your credit card prior to delivering or scheduling services with your patients? I really hope that if the answer isn't yes, Jen and I will convince you at the end of this session to change your practices. You're also going to want to make sure that you're laying out clear details and expectation of your team members. What are their day-to-day responsibilities? People come to work to do a good job, and it's not good to come to work wondering what's expected of you every day. And lastly, I'm a huge believer in it's important to measure something in order to accomplish it. So you're really going to want to make sure that you have good KPIs and analytics. And more importantly, something to understand is that these strategies and tactics can constantly change. It's going to be really important that you consistently work with your organization for the long-term success of your business. Another item that you should consider is triaging work based on products, payers, or stages. If you're a large organization or you have newer team members, triaging the work will really help provide that coverage and that expertise that you need. It's important to dedicate team members on research and education. Think about all the change that we've been through. I've been in this industry for almost 18 years, and I have never seen the payer guidelines change as frequently as they have over the last couple of years. Think about all the changes that have recently occurred with Medicare, specifically just with the continuous glucose monitoring devices. I think there's been 4 different LCD changes just in the last 2 years. If you don't have a team member dedicated to these constant updates and changes, I promise you are leaving cash on the table and have a high volume of write-offs. And we used to be, right, 18 years ago have all these stickies and manual papers, it's really important to now take that education and apply it to your system and those technologies to help drive that process. A good example of streamlining a process is your incoming referrals. So today, if you still have a manual fax machine, I'm telling you, you are definitely not processing those fast enough. You're taking them from the manual fax machine, your team members entering them, they're probably rescanning them in the system and then filing them. It's really important to digitalize those incoming referrals and even your closet orders. You could push those data elements from your hospital systems and have it push into your system to have patients automatically created, have that initial shell, that order, and even initial verification of benefits. Let's drill into this a little bit more. Another great example is accurate insurance verification and medical criteria. You can't just tell your team to call and obtain insurance verification. It's really important to give them a form or a template of those data elements that you require in order to collect that insurance information. Are you in and out of network? What are the in and out of network benefits? Does the patient have a Q&B policy? Are you going to be able to bill this patient at the end of servicing? And then establish when a team member should call further for information. We just touched on it in that last screen. These insurance guidelines are changing constantly. We did not have all these different payer variations that we did years ago. There's different policies within Humana, within United Healthcare. It's really important to ensure that your team members and your organization understands the variations of those medical criteria. Establish regular touch-base meetings with your team. It never feels good to have information come from the bottom up. So if we go back and I talked about, right, KPIs and metrics, it's really important to establish what your expectation is of that team and make them deliver that information to you if they're not reaching those guidelines. No one, right, wants to be saying, hey, why are you not doing this work? What's going on with this? It's really going to open up, right, your team members to have those constant conversations with you. My team, what they do is they know that they have to have all the work that's in their queue done within 7 business days. If they are not reaching those metrics, they need to reach out and let us know, what are they working on? What are their barriers? And we're continuing to talk about this to see what we could do to eliminate these barriers. And it's really important, right, that you're holding the organization and your individuals accountable. And a lot of times you're going to find, especially nowadays, it's also holding the payer accountable. And you're not going to get that information unless you're regularly measuring those KPIs and then discussing them. Integrated technology and platforms. So engagement is so important within our industry. Once you get a patient on, you want to keep them. In ensuring the most compliance and optimal results, you're going to want to find ways that you could reach out to your patients without increasing staff. Jen, do you want to talk about some different digital modalities that we could give to patients as options?
Yeah, for sure. So as Ashley mentioned, she entered the industry 18 years ago. I've been here for about 14 years. And I remember when I first started speaking at Medtrade and among the different state associations that, providers would sit in the audience and be very skeptical of what I was encouraging them to start looking at adopting as far as technology and digital assets. Because it's hard, right? Healthcare is a very tricky industry in that your patients are going to always expect to want to receive a full itemized statement of what insurance has paid, what they owe, etc. So I get it. It's very difficult to overcome that stigma that patients have had so long. However, the fact remains that we have got to start training our patients to adjust to modern technology. I guarantee they are using different forms of digital outreach and technology assets in their daily consumerism. If you think about it, I mean, it doesn't matter what age your patient is, right? They probably have their mortgage or their car payments, maybe even things such as their streaming service, as well as insurance. Those things are probably more of an automated recurring charge that they've set up with either their bank or with the actual merchant themselves. And we need to try to start convincing our patients that it's okay to bring that type of technology into their healthcare daily life as well. Because if you are utilizing the right forms of technology, those different technology assets are going to ensure that they inform the patient before any action is taken. For example, and Ashley, go ahead and move to the next slide for me. And this slide, Ashley, builds, I believe. So I'm going to have you just forward to the next slide. Okay, so just keep it. So what I mean by recurring digital assets, right, is when you're collecting upfront, which is a huge part of your intake process. If that patient is a recurring patient, just like that patient has a recurring mortgage statement, or just like that patient has, a recurring streaming service, you absolutely, it's not even an option anymore, in my opinion. You have to keep a digital asset up front, meaning a digital way for them to pay, right? So a card on file, a bank account on file. And in order to do that, you need to keep it simple and easy for them to consume and understand. It does not have to be complicated. So typically a patient is going to always put up a barrier if you ask them to hold some sort of method of payment on file. They're going to immediately say, I'd rather not. Go ahead and send me a bill and I'll pay the bill when it comes due. The reason they do that is because they immediately don't believe that you're going to let them know in advance before charging their card. I'm the same way. I don't want to give my financial information to somebody unless I know they're going to give me the information before they charge my card. And that's what we will always do at Brightree, is we will always inform the patient before we charge their card, period. And I think that whenever I'm out talking to providers and trying to get them bought into why they need to start doing this, I think that they automatically assume that we're just going to blindly charge the patient's card. And that's just not something we're going to do. We will still continue to give them that upfront notification. So keep it simple, keep it easy for them to consume and understand. How do we do this? Let's go to point number 2. We need to communicate the policy when we're scheduling. So let's just take, for example, if you've got a referral from a patient coming over, my phone was dinging. If you've got a referral coming over for a patient, and when you're calling that patient to maybe get them scheduled to come in and pick up their equipment, or maybe get them scheduled to see the respiratory therapist, whatever the situation may be, you need to communicate that policy when you are scheduling the patient. A lot of times I find providers miss on this point, and they just get the patient in the door and then they're like, we'll tell them after the fact. But if your patient is coming in and they don't have a clear expectation of what is going to be expected of them financially, then they're not going to be prepared to take on that conversation. So when you are scheduling the patient, if it's a customer service liaison, if it's a financial representative, if it's somebody in respiratory therapy, right? It doesn't matter who is scheduling that patient. Make sure that they're communicating the policy that they absolutely must be prepared to put a form of payment on file when they come in. This is extremely important piece of that intake process. Let's jump into point number 3. have a financial agreement ready. So we have multiple examples of this that we can share with you guys. I am more than happy to email. If anybody reaches out to me, I'm more than happy to email you sample financial agreements that you can run through your own legal and compliance department and ensure that it works with the rest of your intake paperwork. If you do not have a financial agreement where the patient is agreeing and signing off to pay for their balances owed, this is going to be a big hole in the process and a big piece of the puzzle you're going to miss. Anytime I walk in, I just had my teeth cleaned recently, and I know that my dental cleaning is going to be covered 100% because I know that my insurance benefits cover 2 cleanings twice a year. But they still have me sign a financial agreement. They do not have me write down my credit card information on a piece of paper. That is not secure and compliant. But rather, they have a 1-page financial agreement that just states that I, the patient, will be responsible for any amounts that come due should insurance not pay. So having that financial agreement, knowing that I, the patient, have to sign that, and knowing that I'm agreeing to that is extremely important at the intake process. It's not after the fact. It's absolutely collecting that up front. Moving on to point number 4, we talk about staff training. So we cannot expect our staff to abide by our new policy and communicate our new policy to our patients unless they are fully trained. And it may sound completely ridiculous that you have to train your patients to do their job, or to train your staff rather to do their job. But sometimes in our daily life of work, we just get complacent. And it's not because we're doing it intentionally, it's just because they're so busy doing all these other items. It's very simple to take some time, sit down with your intake team, sit down with your billing team, and train them both to what your new policy is. Our new policy here at ABC Healthcare is that on any recurring rental item for any patient that is this type of patient, we absolutely have to collect a form of payment method on file. Now, yes, you may have some exceptions to the rule, right? You may have a patient who is duly insured. Maybe you don't need to collect on that type of patient. But remember that insurances change all the time. And there's no specific time of year where insurance can change either. You don't know what their employer or what their insurance states as to when their open enrollment is. So it's always best to have that insurance policy available through a method of payment that you collect upfront. Training your staff to know that they absolutely must collect a payment is going to be extremely important. And I know all of these are extremely important, right? But all of these really matter when you are collecting up front and trying to make a more seamless and integrated intake process. And then point number 5 is you simply rinse and repeat. You have to do this and make sure that your staff are doing this on every single recurring rental patient. What I call your one and done patients, you don't necessarily have to do those on your one and done patients collecting upfront, but you absolutely have to do them on the recurring rentals. This is going to change your business. If you started this now, at halfway through the year, I can't believe we're halfway through the year, but if you start it now, I would challenge you to see how your business changes just in the next 6 months. You're going to start noticing that you're going to collect more from your patients on the private pay side. And not only are you going to collect more, but you're going to keep it simple for your staff. They're not going to have to work as hard to keep that cash coming in the door. So again, keep it simple, communicate your policy when scheduling, have a very strong financial agreement available, train your staff, and then rinse and repeat. It's very simple.
Completely agree. And I guarantee you your patient's going to feel better too. They're going to understand their financial agreement and give you raging results.
Okay, so we're going to talk about how technology is going to be your friend in all of this. So if we think about what technology does, you can go ahead and go to the next slide, Ashley. When we think about technology and what its actual purpose is, believe it or not, it's not to make us frustrated. It's really to make our lives easier. And using technology in healthcare is going to be an integral part of your overall workflow, especially when it comes to intake and billing process. I'm going to go ahead and let Ashley, I'll let you cover the first half of that, and then we can move into the second half as well.
Absolutely. Thanks, Jen. So earlier we were talking about insurance verifications. So it's really important, right, as your organization continues to run into new payers, is that you ensure that your system is fully functioned with all of these configurations, right? 3 fee schedules or 3 price tables within your system is not going to do it. There are variations in every single policy, and you need to make sure that you're uploading those individual fee schedules. When you run into a new insurance verification, you cannot just add the insurance and expect things to work right. You need to make it a requirement, right, for each team member to capture the requirements of that payer. Is it a managed Medicare plan? Is it a Medicaid policy? Does the medical criteria differ from Medicare to what this Medicare managed care plan is? I'm telling you, and I'll show you later in this presentation, you could find all of this on the payer's website. It is not that hard. For that payer, can you submit claims electronically? Do I have options to verify that insurance electronically? You can't just add a new insurance in your system, right? You want to take it all the way through your claim process. Is there going to be an ERA, right? That electronic remittance that gets loaded into the system. Do you have an integrated resupply program? Is this a payer that I want my outreach program to reach out to? All of these things, there's settings that need to be configured. And you need to make sure too that you're defining what the frequency of supplies are, right? So it's really important to capture all these elements, load it into your system, and make sure you have those insurance configurations. Integrate, right, your tools and technology. There are API connections with payers now. They have recently announced by 2026, you need to have electronic communications within the system and options available for providers. By adopting these things, you're going to then increase your engagement with your patients. Keep your patients engaged through their healthcare journey. They're very anxious and they want to get their equipment, and they're going to keep calling you or your doctor's office until they get it, right? So we talked about digitalizing your outreach. So when you're getting that incoming referral, or maybe they're due for a resupply, give them an option, right, to order online. Give them an option where they could get a text message letting them know that, hey, I got this referral, I'm working on your equipment, and we'll reach out to you as soon as possible. Figure out what you could do to stop that patient from calling your office so you guys could get more work done. And then also throughout that process too, you could deliver those electronic forms. So before you even take the time for your delivery drivers, right, to go out and deliver this equipment, you could do this all beforehand. You're going to want to make sure that you got that accurate insurance information. You want to make sure that the patient understands their financial obligations and that you collect it, and have them sign all that information before your delivery driver goes out there. Jen, you want to talk a little bit more about letter engagements and other electronic methods?
Sure. So, of course, we always have the traditional ways to bill a patient, right? You can always, what I call bill and chase. And that works for some patients. But at the end of the day, my job is to make sure that you are utilizing the technology and the solutions available to you that are going to help streamline your business and save money. I don't know if anybody pays attention to postage rates, but postage rates are increasing again, another 5 cents in July. It's just in 2 weeks. It's about mid-July. So if you need to buy your stamps, get out there and do that now. It's going up 5 cents, guys. And so you guys just cannot continue to sustain these increasing costs in manual ways and old school ways of doing things. So that's why we want to digitalize that patient outreach. So what I mean by digitalize that outreach, can you, let's think about our recurring rental patient, right? So if I'm a recurring rental patient and I know that I'm going to have this piece of equipment every month for the next, 13 months or 18 months, whatever it is, then I know as a patient that, because you've already set the expectation with me that I'm going to have a monthly copay, I know that it's going to be a recurring item, a recurring financial commitment. So why wouldn't you go ahead and put me on auto pay, right? Put a bank account or a card or a credit card or a health savings card on file, because I already as the patient know that this is going to be a recurring item every month. And I as a patient want that to be easy, because if I know it's going to be recurring, why would I want to get paper bills every single month in the mail? Why don't you sign me up for email instead? And we will never, ever email out the actual statement, but rather we will email out notification that the statement is ready to be paid. And then we're going to drive that patient for you over to a secure patient portal where the patient can actually pay the bill online. They can also, believe it or not, they can go out and pull up a copy of what the invoice would have looked like had we mailed it out for you. So there's no need for us to send out an actual hard copy to the patient, because they can actually get this through a digital format and through digital modalities. We will send them an email notification driving them to that patient portal, and then we're going to give them the access to pull up that invoice. If they want to print the invoice themselves and put it on their desk or put it in their bill pay slot, they can absolutely do that. But you guys as the provider should not be incurring that cost anymore, because it's not cheap. We will also, as another way to for digital outreach, what about text to pay? Okay. A lot of my bills, if they aren't already set up with a recurring form of payment on file, I will get text messages and with a bit.ly link in the body of the text, and all I have to do is click on that. If you are utilizing the right technology, that bit.ly link that your patients click on should drive them immediately to that patient portal that I was just talking about. And then I can automatically pay my bill in seconds, right there from my phone. I don't even have to sit at a computer anymore to pay my bill. And nobody wants to do that. I don't even have a checkbook anymore to pay traditional ways, traditional bills. I rarely go to my mailbox. I understand, guys, that this may not be the demographic of your patients. I hear that all the time. I understand your patients are elderly and they still like to get bills in the mail. And quite possibly they might even have a caregiver that likes to receive those bills in the mail, right? But at the end of the day, if you guys are not streamlining the outreach to your patients, it's going to cost you more and more dollars in the end. Delivering your forms electronically. I know, Ashley, we talk a lot about how we can deliver these forms electronically. You could even deliver your intake forms. You can mail out, or you can email out authorization forms. There are so many capabilities to digitize those forms that you have to deliver, so you no longer have to keep it, on in a manual format. Even that financial authorization form that I was mentioning earlier, I have several providers who have that form on an iPad. And so when their patient comes in for their first initial intake appointment with the respiratory therapist, they have everything right there on an iPad or a kiosk, if you will. Some of them have it on an iPad, some of them have it on a kiosk, and the patient just goes right to that kiosk to fill out all of the forms right there. It's so smooth and so simple. Yes, it's going to possibly take some investment on your part to buy iPads or to set up a kiosk in your showroom floor. But at the end of the day, this is going to save you so much money on the back end. And if we think about where technology is taking us just in our general consumerism, we have got to start adapting in healthcare to where just general technology is taking us as consumers. We can no longer keep up with the old-fashioned ways of billing patients because it's just not profitable for our business. Ashley, I'll let you jump in if you have anything else to add on.
Those are excellent points, Jen. I mean, I even have customers today who are digitalizing their deliveries, right? So they don't have a driver going out all day long delivering equipment. When they're getting those incoming referrals, there's technology, right, that could measure your patient's face and tell you what that best mask fits for them. Invest in that technology, reduce your costs. That's going to speed up your delivery and confirmation, and again, get cleaner payments. And I can't wait to show you some results later on in this presentation. And just don't forget, the paper is so costly. Jen already talked about, the stamps, but don't forget, I mean, just because the mail or that claim went out the door, there's a high, return rate on those too. People are moving, insurance addresses are changing. So just really look into that electronic outreach in that configuration to eliminate all these manual steps. So now that we collected the card on file, right, the product is delivered, it's time to submit the claim and get the rest of that cash in the door. Right, we talked about when team members, to consider assigning team members by product and payer staff. When you do this, you're building that redundancy. And your team members are going to become familiar with these plans. And eventually, your system's going to be set up great for all of those requirements. Their life is going to get easier. That knowledge is going to be retained. And you're going to be able to increase their productivity, right? And assign them more payers. Also, to tie them to goals. If you are not tying them to goals, I promise you will not ever see any improvement from them. And you want to continue, right, to change those goals to continue to achieve the highest productivity. Right, those electronic claim settings, those are ultimately going to result in a timely electronic claim submission. Look into claim attachments. A lot of times today, when you're sending claims electronically, there's a lot of payers that are looking for that medical documentation. There are areas within the payer portals that you go into every single day, and it will tell you, hey, I got this claim and I need the documentation, and you could easily add it. And then try to eliminate that manual claim processing, but also consider it when it makes your life easier. Invest in a good workflow tool to manage your outstanding claims in your payer processing. One of the things you're going to want to look at is, how do you want this work prioritized? What is important to your organization, right? We're constantly looking at things by high dollar and specialty products. And we also are commonly looking at total processing time. So from the time that this claim got submitted to the payer to the time that it's outstanding, we know if something's right or wrong. We've identified and analyzed so many different payer trends that if I see a claim for a PAP machine that's outstanding more than 60 days for Blue Cross Blue Shield of Alabama, I promise I'm either never going to get paid or someone didn't attach the documentation appropriately. So invest in analyzing your payers so you could easily figure out these items. In this workflow, right, you should consider prioritizing denials over just a resubmitted claim for follow-up. And change those follow-up timelines based on payers, right? I just gave that example for Blue Cross Blue Shield of Alabama, but there are even payers that are extremely far behind in processing claims. They are short-staffed just like the rest of the world, right? It's important to take a look at those average processing times and say, okay, well, for this type of submission and for this payer, I'm going to follow up on these claims after 60 days of submission. That way, you're having your team work on what can be worked and not have them chasing claims that you know are just in processing. We're waiting for the payer. Invest in good quality control. You have to look at the results of your business and talk about them. These areas equal opportunity. It's so important, again, if you foster that an open environment, have that communication come from the bottom up, these areas of opportunity will easily present themselves, and your team's going to be eager to work with each other because they all have the same goal and they all want to beat that goal, and you just got to open up that area to talk about it. And don't forget to utilize your payer tools. Once you get registered with the payer website, if you scroll all the way down at the bottom, even if you go on the Medicare website, you're going to see there's an area where you could subscribe for updates. I mean, honestly, this goes way farther than insurance payers, right? You could get this from any type of website today. And what's so awesome about subscribing for the updates within these payers is you could actually tell them what you want to hear. What is your business around? Are you in infusion? Are you just DME and HME? What type of products are you building? And those insurance payers will send you updates around those. All the payer guidelines and the manuals are on there. It is so easy to go on there and find the medical criteria. You are going to find that it is different from Medicare. So if you are a practice is like, well, I'm following everything for Medicare, I highly suggest you to reconsider that process. There's claim scrubbing features. So within Availity and Optum, they have claim scrubbing tools where you can know right from those payer websites if your claim's going to pay or not. Chat features. You don't need long hold times anymore. Go on that website and use the chat feature to talk about your claims. And then, as I mentioned, there are so many changes with all the payers in our organization. The systems do not get updated as fast as those updates get pushed. Again, I'm going to go back and pick on the continuous glucose monitoring devices, those CGMs. At the first of the year, Medicare, changed their guidelines where you can now provide a 90-day supply. When that happened, they did not fix the system to actually process and pay those claims. All the claims denied. It's important that you're staying in contact with your provider relations and have regular meetings about them. They're there to help you. And don't forget about your state associations too. Here's an example of what it could look like to go onto that payer portal and register for those notifications. So this is specifically with Optum. So I went in here. Once I log into this portal, you could see this is the notification center. It lets me know things that are coming up, If I need to update my contract, if I need to submit licensing information, it will even tell me if there are guidelines that have changed to prevent me, from getting a delay in cash. As I mentioned too, you could personalize this news. So as you could see here, I scrolled all the way down to the bottom and I filled out the information, and it will let me choose what my specialty is.
Okay, so I was talking about earlier, the traditional ways to bill and the automated ways to bill. And I really wanted to give you guys an image to think about. And that's the image that you're seeing on the screen here. So the top half, I call it choosing your hard, because we know that it's hard to collect from patients, period. They just don't want to pay for it. A lot of patients believe that they get a sense of entitlement, if you will, because they have insurance. Well, I have insurance too. I have really great insurance, but I still have to pay something. It's still, I still have premiums. I still have deductibles. I still have to pay for my insurance. So choosing your hard, you can choose the top half of this graphic, which shows traditional letters. And this is what I call the bill and chase way, where you could take up to 120 days until you get payment. That's not a very financially or fiscally responsible way to collect. Because if you think about how many statements you would send out to your patient to try to collect, it's going to get expensive. Not only that, if you send out the invoice and then you give them, 20 days to pay, and then they don't pay, now you're sending out a bunch of past due reminders, right? Reminding them that they have a balance due. It could be a balance for $20. And when you think about how expensive it is to send a piece of paper, if you still have somebody in your office printing out statements at the end of the month and putting them in envelopes and putting stamps on them, taking them to the mailbox, this is an old way. This is just an archaic way to do things, guys. We have got to change the way we're doing things. Not only that, maybe you're using staff time, or maybe you're using an automated calling system to remind the patient that they haven't paid the bill yet. That gets even more expensive. Now you're paying for a full-time employee to call these patients, remind them that their bill is due. Maybe you're using, AI or automated technologies, and that's great if you are, because that's important as well. But if you're using those automated technologies, that's costing you as well. Whereas if you thought about, if I would have just collected a form of payment up front, I wouldn't have to waste all this money on this follow-up process, right? And then if you can't even collect it after you've gone through the statement, you've gone through the past due letters, and now you've tried calling the patient, they still don't pay, what are you going to do? Are you going to send them to bad debt collections? Are you going to have a phone collection agency call that patient and try to collect? Because those collection agencies are not cheap. A lot of times they charge anywhere from a 30 to 50% contingency fee. If you think about a $100 bill for the patient, and you have to pay 30 or 40% of that to the phone collection agency, now you're only getting back $60 to $70. That doesn't even hardly cover the cost that you went through to send out all of those invoices and past due statements. Not only your employees' time to call the patient and remind them, now you could be profiting maybe $5, $10, $15, $20 at the end of the day. It's just not worth it anymore. It is not a fiscally responsible way to collect from the patient. Rather, I'd rather you consider the bottom half of this graphic, where we have auto pay and e-delivery on file. If you think about collecting that card or that bank account at intake, and when you have that card or bank account set up at intake, now you can go ahead and give the patient 20 days until the payment charges, right? Because again, we want to give them time to get the bill in the mail or get the email in their inbox. We want to give the patient time to look at the charge, make sure it matches their insurance explanation of benefits. And if they do have any questions, they can still have time to call you and ask you. So do go ahead and give them that grace period of 20 days. But then once that 20 days hit, then it's going to charge the card or the bank account on file right away. And then look back at the top half of this graphic. Look at what you save in that process. You no longer have to send past due letters. You no longer have to have your customer service representative call the patient and remind them the bill is due. You don't have to implement a virtual agent or any technology to call the patient and remind them, because you're now going to get that payment on time every time. Plus, there is no postage. Think about this. If I can send an email to advise the patient that their bill is going to charge in 20 days, all I've incurred is the cost of the email. How simple is that? How cheap is that? And that's exactly where providers need to go today. So Ashley, I'm going to have you go ahead and go to the next slide, and I'm going to continue talking about just securing these assets. And I wanted to give you guys a few quick and simple and easy to consume bullet points as it pertains to what it means to collect a card on file. You're securing your assets. If you think about this, it's a form of insurance for you. If I was down at a provider's, I was doing a training on site with a provider. This was many years ago, but it still rings true to me today. And as I was doing the training when I was in their office, one of their delivery drivers came back and mentioned, as I was sitting with the team, mentioned that one of their patients had one of their wheelchairs on their driveway, selling it in a garage sale for $20. Now, I don't know if that patient had paid outright for that wheelchair. I don't know if that patient was renting the wheelchair. I don't know what the true story was. But if you think about if that patient was just simply renting that wheelchair from you for a certain amount of time, and you had to, and they never gave it back to you. They didn't pay for the bill, and they never gave it back to you, which, by the way, we did look the patient up, and they had never paid for the wheelchair. Now the patient is trying to sell the wheelchair themselves. So if you think about if you would have had, if that provider would have secured a form of payment on file for that patient, then they could have went ahead and charged that card on file or that bank account for the balance owed for that wheelchair, then they wouldn't have been out that money. So it gives the provider, it gives you guys a sense of insurance for any non-paying patients. It also helps to just automatically charge the payment method. We will always, as I mentioned before, we'll always give notice to your patient first, but you shouldn't have to wait for the patient to send the bill back and authorize that payment, right? You need to just tell the patient, we will automatically charge your card on file if we don't hear from you before said date. That's the way everyone else in healthcare is doing it, guys. We have got to we've got to catch up with what everyone else in healthcare is doing. And it gives you little to no intervention from your staff. Your staff doesn't have to pick up the phone. Your staff doesn't have to, press a yes button on the website to charge the card. Your staff doesn't have to do anything. It will automatically do it itself. This is the beauty of technology. Not only does it give you little to no intervention from your staff, but it's easy for your patients and their caregivers. Now, my dad lives 5 hours from me, and he's 75 years old. My sisters take him to all his doctor's appointments, but I actually manage his financial responsibility. I have so many different portals set up for him because I'm not going to wait for somebody to send me a bill in the mail. Like I mentioned, I don't check my mail. My kids go to the mailbox as a novelty item. I don't get anything in the mail that I pay anymore. Everything goes to my email or it goes to a charge automatically. And that's easy for me as his caregiver to be able to have his healthcare just set up on automatic charges. I can go in, approve the charge if I want, or I can have it set up to automatically pay. This also helps reduce labor in chasing down those patient balances, as I mentioned in that graphic above where it showed maybe somebody in billing trying to call patients to pay. Now your labor resources can be assigned to higher payoff activities, working those insurance balances, working with the patient, whatever it might be. The last thing you want to do is chase down a $20 balance and use a staff member who's possibly getting paid $20 an hour to chase down that balance. It makes no sense. We will always notify you guys of any insufficient funds or bounced payments. So for example, if you tried to charge the bank account or the credit card on file and it didn't go through, maybe it was due to insufficient funds, maybe it was due to a different card. We have technology built into our solution that will automatically try the card again or try the bank account again. And you don't have to do anything. You don't have to pay for it either. It'll just automatically retry the card if there's an insufficient fund or a bounced payment. And then of course I love to call it my crock pot meal. You kind of set it and forget it, or rather set it and watch those balances get paid. So you do not have to go in and tell it to charge the card. It'll just automatically do it itself. So set it and forget it, and it's going to charge those balances automatically. So moving on to the next slide, manual workflows. So we wanted to start sharing some stories with you guys as we're getting to the end of our presentation here. Manual workflows, the stories and the data. So I went ahead and pulled some data from Brightree customers in 2023, and on average, it took 45 days longer to collect through those manual processes, where you have somebody has to call the office to make the payment, or mailed reminders or reminder calls. Those are all manual processes. The in-office payments, it took 45 days plus on average 3 pieces of of patient communication. So 3 invoices or 3 reminder letters. It took 3 pieces of mail to remind those patients to pay. And the reminder call payments, those ran on average of 64 days, plus 4 pieces of patient communication. This is just unnecessary. It does not need to take this long to collect from a patient, especially if the patient was reminded and told at the intake process that they're going to have a balance owed. It's simple as that. If we tell our patients up front that they're going to have a financial responsibility that they will have to pay, it's no longer going to take upwards of 50 days or longer to collect from those patients. Moving to and then I'm sorry, just a quick question to ask yourself, how long does it take you guys to collect? Have you actually dug into your own data to see how long it takes you to collect? I'm going to challenge each and every one of you that's listening to the webinar to go ahead and dig into that and see how long it may take for you to collect from your patients in this old-fashioned kind of traditional ways. I challenge you to do that after you listen to the webinar today. Okay, so moving on, we've got, and Ashley, I think you can go ahead. I guess this is a build-out slide. I think go ahead and start with the first arrow and the first bullet points underneath. Yeah, go ahead and build it out. So we just wanted to show you guys just kind of a workflow of how this build-out works. And go ahead and continue clicking, Ashley. I know there's some other bullets here, and we'll just kind of go through those. Ashley, I'll go ahead and let you start, and then I'll jump in where mine starts.
Absolutely. So we just wanted to really just circle back around, right? We talked about bringing in that order request and digitalizing that information, right? Having that information from the EMR system automatically transition into your system, trying to automate that verification of benefits, or at least tell your staff when they should be calling further for insurance verifications, right? On your initial setups, and maybe every 6 months you want that verification recalled on. Ensure quality insurance. Capture the medical criteria that's required by each payer, and make sure that you're providing that quote of benefits and that duration of need and services to the patient. Again, keeping that patient engaged is going to help not even keep your patient compliant, but ensure quick cash collection. Go ahead.
Sorry, go ahead, Ashley.
No, go ahead, Jen. You could do it.
Okay. Yeah, so we're on the third arrow here. So collecting that method of payment, completing the delivery of product. I see so many providers deliver product without collecting anything from the patient first. I still don't understand why we're doing that, guys. We have got, if we're going to deliver, especially out in a rural area, if we're going to deliver something to the patient, please start collecting those method of payments up front, and then you can complete that delivery of product.
And then once that product's been delivered, go ahead and electronically submit that claim and make sure you have a solid routine follow-up process of those outstanding claims. Once that claim's paid, then make sure, right, you're, Jen?
Yeah, collecting the email, right? So we want to ensure that we're collecting digital assets. And I don't have it on here, but I'll just go ahead and state it. Like, I guess I do have cell phone for text reminders a little bit down the road. You should be collecting email and cell phone addresses, or email addresses and cell phone numbers for every single patient. It's just the way that healthcare is moving. And if you are not doing that today, you're already behind your competition that's doing that. With an email address, they can also register for that bill pay site registration. This gives that patient the ability to be self-sufficient. Moving on to that next arrow here with the computer on it. If you give your patients that payment portal, they will use it. I promise you they will. They're going to want to be self-sufficient. If you think about some of your younger age patients also, maybe they're working crazy hours, maybe they're doctors, maybe they're paying their bills in the middle of the night when everyone else is sleeping. If they don't have to call you and ask for those bills and ask you for a copy of their statement, that's going to save your staff and your time and labor resources. Moving on to the cell phone for text reminders and late notices. This is so important. I love getting text messages for late bills, Of course, I'm very rarely late on anything because I have a card set up with everything, but it does help remind me if I have a bill coming up that's due. I also get a text reminder just telling me that I have a bill coming up and I need to plan on paying it. It's just so helpful for me as the consumer and as the patient to know that and have those digital modalities available to me as a patient in healthcare. And then if it all comes, if you get through this entire process and you still have to make reminder calls, let's automate those reminder calls. Let's not have a staff member calling the patient daily asking them to pay their bill. Let's automate those reminder calls through technology, through virtual agents, and through AI. This is what technology is doing for us, is it's making our jobs easier. We just have to start adopting it and accepting the fact that this technology is going to have to be used by our patients at some point in time. So
and everyone's using it, right?
Using it, yes, everyone is. So now we're going to move into some success stories and kind of push through the last half of the presentation here. Others have exceeded, will you join them? So let's go ahead and move on to the next slide. Again, I was curious how our own customers were doing when it came to automated versus manual payments. And you can see over the course of kind of a 4-year time period, I pulled up from 2020 to 2023. And if we remember in 2020 when COVID hit, everything needed to be, paperless or touchless. Nobody wanted to touch anything. And I think that COVID was good for us in that sense, is it made us really adopt some of these technologies that might have been harder for us to change. So you can see how the automated in the blue, how that changed every year. Look at it from 2020 is the blue graph, the blue line chart rather, from 2020 to 2023. Look at how the automated payments changed just in 4 years. And then look at the manual payments. They kind of stay stagnant. They did increase just a little bit, but that's also probably an aspect of just businesses growing and adopting more patients and getting more patients. Maybe that was through M&A also of you guys acquiring other providers that maybe weren't used to using automation. But the manual payments really, for me, in my standpoint, they really kind of remain stagnant compared to the growth of how the payments came in. And then, of course, I also added a percentage of those payments. The percentage of the payments also, just the percentage of the dollars collected went up, whereas the percentage of the manual went down. So I found that very intriguing. I also wanted to show you guys on the next slide, I wanted to show you that we have a calling system. I mentioned kind of through the course of this presentation, I've mentioned kind of automated systems, automated calls. And if you have to use something like this, which I do recommend using, because if you just scroll down right to the bottom, the ROI that we see providers collecting is phenomenal. But let's go through this really quickly. So patient AR paid through an IVR system, this is over 2023. We found $14.5 million come in through an automated IVR system. This is not somebody answering the phone. This is actually just an IVR. This is just an automated payment line that you should be using. It's a 24/7 payment line that you can easily print the number on your invoices. And these are patients that have proactively called in themselves to make a payment. Calls received that did not require a live person to answer. I have 447,000. I got a dollar sign there. That's a mistake on my part. That's how many calls actually came in, guys. It's almost 500,000 calls came in through this line. Hours that were saved, so time saved from making these calls. This is from your staff. We estimated this saved your staff around 25,000 hours over the course of 2023. That's time saved. Think about how many hours and how many people that is and what they could have been dedicated that time to doing other things. And the return on the investment, this is the big one here. For every $1 spent that you guys spent on this technology, you collected almost $30 for every $1 spent. That to me is a successful return on investment. And just by having an 800 number or a local number printed on your invoices that give your patients the ability to call any time of day to make their payment. It's through an automated system. And here's the thing, guys, is the patient trusts it. And here's why. Because it is printed on your invoice. It's printed on the invoice that they received via email or via US mail, however you decided to send it. It's a number that's simply printed on their invoice, so they automatically trust that the money is going to go to you. And it's clear in the stats that you see on screen. So moving on, another way that providers had success through using technology, I just wanted to put on screen, just again, this is a time period of over 2023. Total patient, providers who are using these technologies through automation, they build out about $12 million. 30% of their invoices were sent through email. That number is not high enough in my standpoint. I'd love to see this number get to 50%. Imagine if 50% of everything you build went out via email, and how much money you guys could save. 85% of the patients paid through an automated method. That means that these patients who are using these technologies, 85% of their patients were paying through automated technologies. That's through the 24/7 payment line. That might be through a card on file. That even includes going to the portal and paying the bill, setting up their card on file through the portal. And only 5.6% of patient AR goes to bad debt. Less than 6% of patient AR goes to bad debt. I'd ask you guys, how much bad debt did you send off how much debt did you send off to bad debt last year? This is actually just one provider. I apologize, I misspoke. I said providers over the course of 2023. This is actually just one provider that we did a case study on. They are in the top 25% of their peers. They will actually turn away the business. They have drawn a line in the sand and they said, you know what, if they're not going to abide by the way that we collect, we're going to turn them away because they can go to our competition and do it somewhere else. And they collect 91% of everything they bill. Imagine what that would look like for you guys if you were able to collect 91% of everything you bill. It's a phenomenal story. Ashley, I'll let you go to the next one.
Yeah, absolutely. Yeah, in this example, we have this customer who seen significant improvement by moving their CMN, auto CMN renewals into one single system, updating that CMN form type, right? So we talked about some payer changes. Medicare changed the oxygen from a CMS 44 to a standard written order. And then also turning on a technology of auto renewal. So automatically sending out those annual prescriptions to physicians. You could see here that this customer reduced their held AR by over $1 million, 82% within 6 months by just streamlining that process and adopting a little bit of a technology. This customer here, they went from a paper process to electronic order processing system. They ensured that their orders were identified properly within their system, using order automation to drive orders through the next stage and keeping their patients in constant update status. They weren't using all the fields in the Brightree system to appropriately identify their outstanding orders that needed to be delivered. And once they adopted that, they were able to easily look at the data to figure out where those gaps and challenges are and where they needed to streamline that process. They also weren't confirming their orders in a timely fashion either. You could see here by, again, just utilizing the system to its fullest capability, you could see that we've increased the time it takes, or I'm sorry, we decreased the time that it takes to get that product to the patient. We went from 82 days to 14 days. And then for a resupply patient, we went from 13 days to 2.5. You could definitely see that we are trying to keep up with Amazon here. And this customer is running and playing and firing from all cylinders possible with technology, automation, and even services. This particular customer, you could see here in their numbers, this is their open aging. What we do is we measure success of your open aging by a metric called a 90-day roll. What this is telling you is on average, how effective your team is in collecting your cash that's going out to the payer. You could see here in 2023, 3.5% of their monthly revenue is falling into that 90-day roll. This is phenomenal. On average, I see customers anywhere between 10 to 15%. And if you're over 15%, you either have a payer issue or you have a large area of opportunity for improvement. You can see we also decreased their denials by 24%. And look at their write-off ratio. Their write-off ratio is only at 2%.
Amazing. Yeah. Okay, guys, I hope that we have given you some items to really think about. Think about how technology can not work against you, but actually work with you. I know that technology can sometimes frighten us, but at the end of the day, if you are not adopting integrated, streamlined technology solutions when it comes to intake, when it comes to patient billing, again, you are going to be just spinning your wheels and spending a lot more money than is absolutely necessary to achieve the same result that you would otherwise. I would like to just ask for you guys to share some feedback with us. We love to hear how this webinar may have been useful to you, maybe how we could change the webinar. So if you don't mind taking a quick scan of the QR code in the top left part of the slide, and just give us your feedback. We're always looking to enhance these webinars and adjust according to what you guys are interested in hearing about. And Ashley and I have also left our pictures on the screen as well as our contact information. So please, if you do have any questions at all, please don't hesitate to reach out to us. Please email us and we'd be happy to help you along your own journey in collecting more from your patients and streamlining that intake process. We appreciate everyone joining us today, and stay safe out there.